Today we have to talk about COVID-19 cases. We're going to compare from some different countries and really talk about why this is important to even look at. Because New Zealand just hit 0 cases. They have no active cases. Now, we have added 60,000 cases just yesterday. And other countries like South Korea, they got their same case on the same day we did. Their first case, our first case, they have only 1,000 active cases. Just under 1,000 active cases total. Now, we haven't done well with the lockdowns. We haven't been doing well with masking. People are protesting against it. My civil liberties, my rights. Stop. It's literally killing people. That sort of thing is literally killing people. And we have the numbers to prove it. We've had 138,000 deaths so far. And what we're seeing is a massive spike. You know, people say that we flattened the curve. Well, we actually did. It started to come down, but then now it's actually spiking way back up. Where every other country is going down and staying down, we're one of the few countries where we're spiking and going back up. Now, a lot of people say, hey, you know, we know what's best for our own health and our public health. And there was this sort of libertarian model where they're like, tell people what to do, but don't enforce it. Just kind of let them do whatever you want. Well, that's what Sweden tried. And people were talking to me about this for a while. They were very excited about Sweden's model. They say, hey, just let everybody be responsible and kind of do things the way they want. And they kept their economy open and they didn't make any mandates. And their death rate per million is 40% higher than it is here in the United States. They're a small country, so they've had 5,000 deaths, which may not sound like a lot in comparison with our 138,000, but they're a country of only 10 million people. We're a country of 320 million people. So per million people, their death rate is actually quite high. A couple other numbers I want to go through. Florida just added 15,000 cases yesterday. 15,000 new cases in Florida. That's massive. The United States as a whole had almost 500 deaths yesterday. 500 deaths. I'm going to go through some of these other countries we were talking about. New Zealand's total deaths that they've had is 22. 22. Not 22,000, not 2,200, 22. They've had 22 deaths because their leadership is a very liberal woman who respects science. And we have a game show host, reality TV star, who decided he wanted to try to keep the economy open and try to do better that way. Well, now our economy is doing worse. See, New Zealand, being at 0 cases now, is able to reopen. If you go online, you can look at a map of where your U.S. passport can get you. U.S. passport used to be the best passport in the world. We can't go anywhere. We can't do anything. And our economy, even if you can go get your hair cut, are people going to actually do it? I mean, I'm not. And so you see that it's actually hurting our economy more to have stayed open, which is what we were saying all along. Fox News had this talking point that a lot of people were doing. A lot of people on the right were saying, hey, you know, it should be our right to go out and work for our kids and risk our lives because, you know, we want to work for our children and the economy that we've built. We don't want to let that go. And one of the things that people on the left were saying this entire time was, hey, it's not going to be good for the economy to have a bunch of people dying. It's not going to be good for the economy to have this virus spreading. Of course, one mistaken talking point that people bring up is they try to say that we're increasing in new cases, but the death rate is going down. Now, there is some truth to it because we are starting to do more testing, and we are testing some people who are not as sick and not as severe. But the other thing that you have to remember is that there's a about 3-week lag between the time that we get new cases and then those cases turn into new deaths. So unfortunately, we're really not out of the woods with that either. This 60,000 cases that we added yesterday, that's not where that 500 deaths yesterday came from, obviously. People don't get it and just instantly die. It takes time for that to happen. So we're going to see the fallout from this week's new cases in about 3 to 4 weeks. There's another really important fact, is that this isn't binary. It's not live versus die. That's how people are thinking of this, and they say, oh, well, if the death rate's only 0.2, how big a deal is that? Well, besides the fact that once everybody gets it in America, that's 3 million people, the other thing you have to remember is there are people who are maimed beyond just getting a flu or a cold and then just getting better. I know people who have had to start using walkers because of the damage that it's done to their lung capacity, a family member of a friend. And this is the sort of thing that people don't think about, is the permanent damage that this could be doing to people's bodies. And, you know, these are all factors that we're going to have to take into account. The mistakes that have been made based on denying science are irreparable at this point. There's been people battling out on both sides. Should we wear masks or should we not wear masks? Should we social distance or not? I just read an article today about a 30-year-old who went to a COVID-19 party. And one of the last things he said to one of the nurses before he died was, I think I made a mistake. And he did, because the 30-year-old died because he thought this was a hoax. And I've been talking about how dangerous it is, the language that the president uses, because he uses the word hoax when he's talking about COVID-19. And he had been since February and March. Now, there's all these technicalities that people like to use, and they say, well, hey, whoa. Technically, he did not say that the virus was a hoax. He said the way that the Democrats were talking about it was a hoax. And so it was able to politicize a public health crisis. And so, but that word hoax, you know, people like to mince words when they're trying to defend somebody, but the people get the message that they're supposed to. And people like him thought, it's a hoax. And he went and he got it and he died. And his blood is on Donald Trump's hands. And if you're still not taking it seriously, you have to look inside yourself and say, if I'm not taking it seriously and I'm doing things that are going to spread it more, are you responsible for what happens in your community? I mean, what we're learning through this is that we're only as healthy as the people around us. And now on a global scale, nobody else wants to be around us, which is why your passport is basically useless at this point. So you got to share this information with people. You can share this video, or I'm going to put some links in the description and you can share those. You gotta get people to understand. I don't know how else to do it. It's getting frustrating. You know, there's just so much death and destruction, and the economic fallout is worse than it would be if we had just gotten through this thing. But unfortunately now, it's only going to get worse from here. So join the conversation in the comments, and I'm also going to be posting this on the Facebook group. Join us there, and I will see you guys in the next video.